I would like to begin actually with a question to the audience, and I hope this works. So, my talk will be about digital healthcare, about real-world evidence, and how the world is changing in healthcare. So, let me ask a simple question. Do you know a digital app or a mobile game of the last 10 weeks that has created a lot of attention, and people also speculated that it has a positive impact on health? So, Pokemon Go, perfect. So, this usually doesn't take long because there's still so much attention to this. And that's exactly right. So, Pokemon Go, why is this so exciting? Why is this so interesting? Basically, it's a game, right? So, we're in this area of digital where people have games. And all of a sudden, these games are speculated to have an impact on health of patients. So what is this about? If we look at the distance that people walked while this app was released, and you see this here on the chart, so these are the steps at certain weekends when people go out, and you see, unspecific to Pokemon, people just walked almost twice as much on average when this game was released. That's certainly amazing, and I would like to give you a comparison to make this more graphic. So the author of this game has published that people walked 4.6 billion kilometers with the activated game. How much is 4.6 billion kilometers? Well, this is 30 times the distance from Earth to Sun. Yeah, that's so much, that's difficult to imagine. So people walked 30 times the distance from Earth to Sun playing this game. And then people say, well, let's look at the calories people burned in excess usually, and you see, well, they took extra steps, so this is additional calories burned. And so just for fun, and I made this presentation in Switzerland, I calculated this in chocolate. So how high would be a chocolate tower equivalent to the calories burned with this game? So if you take big chocolate bars and you create a tower, this tower is higher than 1,000 kilometers of chocolate that would be burned while with people walking around with playing this game. That's really amazing, and it just shows what digital is doing across the globe. It's transforming the lives of every human being, more or less, sooner or later, and has a huge impact on life and how we are behaving. And it goes beyond just walking. If you look at the tweets that people send, you find very unexpected things like this one. Someone says, hey, playing Pokemon Go is really unusual and it's amazing because I know people who are depressed, people who have schizophrenia, or people who have agoraphobia. So these are patients who are usually too shy and based on their personality, they rather stay inside the house and they would be anxious to go out and socialize with other people. But playing this game, all of a sudden they go out. And I think that's really an amazing example of what digital can provide in terms of added health benefit to human beings. Having that said, it's not without risks. If people play the game walking on the street, if they don't look for cars, of course there are also issues and we are aware of this. But this is what is so important about healthcare. This is not just a game in healthcare. There's a benefit and there's a risk to what these digital technologies will bring, and a proper assessment of these two will be quite important to understand both dimensions. So my talk will be about how big data are changing the healthcare industry, and I've actually put more chocolate in my presentation today, so you will see another slide. But it also tells you a little bit of how healthcare is different, because when you look at some other technologies, big data in smart cities, this is slightly different than what healthcare certainly is. Let me begin with trends in healthcare. This is a market in the end. Everybody in this room is part of a healthcare system. You may receive services. So what's impacting this market? Well, nowadays, patients get more and more empowered, and people are asking for certain things because it's very transparent to them if they don't receive the same services as someone in another country or another region, for example. That's good, of course. There's a strong pressure on resources, partially economically driven, but then also the fact that we have more and more technology coming. There's more and more pressure on budgets in each country. Healthcare is a very strictly regulated industry, so you cannot just come with a product and start promoting this product. You need to have proper evidence that this product is working, and when you go into promotion, this needs to follow a lot of very clever rules, which are also necessary to avoid problems. And then the payers nowadays get stronger as well, so they recognize they have a lot of influence, and this is something to deal with, of course, for all companies. And maybe the biggest trend changing the world is digital health, and this is certainly also what it's about today. So let me take a step back. And this is a slide that I think we have seen already. What is big data? I think after so many presentations, that's easy. Data sets so large and complex that the usual processing algorithms and technologies are inadequate. And this is also has been said a couple of times already here. 90% of the world's data has been produced in just the last 2 years. Because the generation of data is getting faster and faster and faster, and this is a consequence. And we need to get better at diving into this. But then in healthcare, people don't talk so much about big data. Sometimes they do, but usually not. They would rather call it real-world evidence. So I would like to ask you another question today, and I would like to ask you a very simple question. If you think of yourself and your birth, you probably have some documents at home, and I would like to ask you, and basically to raise your hand, how many of you have a document at home which still captures your birth weight? So for me, I know I have a picture at home, and my mother has written 3.5 kilograms or something. And so, see, all of you still have this, right? This is real-world evidence. It's a single number. This is certainly not big data, but your mother wanted to know this, the physician wanted to know this, and maybe your mother also has drawn a little chart putting you on a balance each week to measure how well you are. So this is a very relevant piece of data that we would like to find, and if today we have so much more data, we should not just take all the data, we should find the data that matters. And the birth weight of the kids, of course, matters very much. This is a very small example of real-world evidence. And today it's exploding. Everybody fills out a form. Your physician maybe fills out a form for you. You go to the hospital. And there's so much more data being collected. And it goes into huge databases. This is an example for a health insurance form. Somebody puts in your data. And today you can buy databases in an anonymized form that capture more than 100 million patients with these claims databases. And if you think about it, that's a great resource for research, and it really is. So you can go to these databases and you can see, are there patients that have a certain disease? How often do these patients go to the hospital? What kind of medications do these patients receive? So these kinds of databases are getting really powerful because of the quality that's getting better, but also because of the sheer amount. Because at some point you can also filter in and you get to very high quality data sets. So coming back to the definition that I wanted to provide, what is the difference here to big data? Well, real-world evidence is evidence generated in routine medical practice used for decision-making. So whatever is not used for decision-making, we can actually put away. And what are the data sources we would use? A few I mentioned, but there would be much more. Blood testing, lab values, mortality dates. There would be social media, which is of course very big and very unstructured, difficult to deal with. Pharmacy data, hospital data, observational studies, many, many more. And what's so interesting now is that these data sources are growing and they're getting better each year. And you can use them very well to study how diseases develop, how patients are doing, and it's a very attractive resource for any healthcare company, certainly not just pharma. And what I've brought today is one example of one disease area, which is called heart failure. So the question is, how many data sources can we find across the globe that we consider high quality and good enough to support also scientific research in heart failure? And we've done this mapping, and it was quite amazing to see that more than 1,000 of high-quality data sources could be identified worldwide. And it's not just all USA, you also have plenty of data sources in Europe, but also Asia, China, Japan, they're all there. So it's fair to say that these relevant data sources for healthcare research are globally abundant, and that's a great starting point for us. And we can use them. So if you think about it, what's relevant to use these databases? And I would like to explain what would be a good approach that also a number of companies are following. The first element of the strategy should be, do we really understand this data? Because often it will have issues and quality problems, missing data. It is observational data, as people call it. So that means you have to take what you get. If someone puts in mistakes in a hospital, because that's just what happened, you have to find ways and statistical algorithms to deal with these problems. There's no way around it. You cannot clean all this data and get to perfect data. That just doesn't work. So understanding it and understanding the right methods to use it is absolutely key to perform high quality research. Now the second one is, and here's getting really interesting, you can study not only the technologies that people use, drugs, devices, procedures, other things. You can also study the gap versus what should you do on top of this. What could, for example, an iPhone app or an Android app provide as additional benefit to patients? And this is where it gets really interesting. So you can very well study the disease, patients, the products, but you also learn what is missing and what needs to be put on top of this with additional solutions so that you get really to a very high quality care situation. And the third pillar is, and has been already mentioned, I think, yesterday, so people saw with the car and automobile industry that they don't say anymore they sell cars. Today they would say already they sell mobility solutions, and possibly this is a trend that we see here also in healthcare, where companies go away from a transactional model, companies go away from just selling pills. They would like to understand the whole situation and be able to provide also solutions that go beyond just transactions and pills. Really important aspect for getting the future also right and moving in the right direction. So please let me go to the first column, and then I come to the others as well. So when it comes to understanding real-world data, what are the benefits? And I brought you a very nice example. The data is a bit old, actually, and will just be updated, but it's still true, and the big picture still is correct. When we look at European countries, and you see a number of them shown here, and we look in heart failure at the so-called death during first admission for heart failure. So people are very sick in heart failure, they need to go to the hospital. What happens next? How likely are they to survive, or would they actually die as part of the admission to the hospital? And it's very amazing to see that there's a huge discrepancy. So you see this data here from Sweden all the way to Switzerland or Austria. All these countries have probably the same health technologies available. So how can it be that there's such a strong variation of the outcomes, and the likelihood of death is 3 times higher in a country like Switzerland as compared, for example, to Sweden or to Italy? That's really what it's about. It's not about the drug in this case. It's about how the drug maybe is used. It's about how physicians practice care. This could be about the training of people in emergency rooms. This could be about many things. And we just learn based on the data that the discrepancy of outcomes is huge. So to come with another example and make this a little bit more transparent also, many companies use randomized controlled trials. What is such a trial? Basically, a trial is a confirmation experiment. Someone says, I have a technology, most likely this will work. I put it in a trial, and then I study the patients with this technology, and I study the patients without this technology. And this is what you see here. So basically, there's a drug, And in this disease, it leads to a risk reduction of 52%. Seems to work. It's a very significant benefit. And then you look at this in the real world, which means there's no trial, there's no, monitoring, there's no extra guidance for the nurse or for the physician to follow. And you look at the same things and you see the drug works. There's a 50% reduction of the risks. This is good. But why is it that the axes are offset? And it seems to be the case that in the real world, you see worse outcomes. Because this axis here is about a relapse rate. And so all of a sudden, if you go from trial to the real world situation, you get results which are not so good anymore. And in fact, there's a significant difference. So this connects to the slide before, where you see these variations across heart failure, across countries. And so it simply is a fact that in real world, people forget to take medication. People maybe are more sick than in the trial. They could have other care situations with the physicians. And this is really what it's about. There are strong differences, and big data or real-world evidence can help us to learn about this. So we absolutely have a nice starting point to learn about the technologies and what is missing towards a great care situation. And how can we put this in practice? Well, this is then what the second pillar is about when we would like to go beyond the products. And this is the second strategy called Enhance. And let's just take a step back. I mean, what we really need to do is look at all this data out there and then be able to select the right sources of this data that basically provide quality signal and quality information as well. So in this big ocean of big data and real-world data, can we collect and analyze such data that helps us to learn about health outcomes of patients? And I compare this a little bit with, a small baby learning how to recognize objects, learning how to recognize faces. This can be learned, but we have to be very good at learning and improving over time. Or you can compare it with listening to music, or you can compare it with recognizing the relevant patterns of how well a heart, for example, performs. Yeah. And there are also, ways to do this in the wrong way. So what I would like to bring you is one example here. So my second chocolate example. People looked at the number of Nobel laureates per country, and they looked at how much chocolate do people eat per country. And what's amazing is this is a very, very strong correlation. Yeah? So if you see something like a p-value of 0.0001, this is highly, highly significant. But the question is, does it tell you something, and is there truth behind it? Well, there's a scientific paper out there, and in this paper, someone speculates that chocolate contains flavonoids, chocolate contains many healthy things, so maybe eating chocolate will make you smarter, and you can win Nobel Prizes. Yeah? But it goes beyond, right? So this is not everything. And that's also too simple. So people looked at it and they said, I don't really think this is what's going on. So can I find other data? Can I take the chocolate out and put something else in? And maybe it works even better. So I just mentioned two of those. What gives even a better correlation is the number of IKEA furniture stores per country. Yeah. So the number of furniture stores per country has a higher correlation with receiving Nobel Prizes than chocolate. So that's good to know. And it goes beyond. So if you look at GDP, so the gross domestic product per country, that also has a very good correlation. What it possibly means is that if you live in a country where the resources are abundant and maybe the government is investing a lot into education, this would make some sense. That's my personal opinion. But the correlation with furniture stores and chocolate, I simply cannot believe. So I would say, no, don't start eating chocolate now, because it probably doesn't work. And we need to get better than that. So the lesson from this is you can find, with big data, you can find a lot of correlations. They will be highly significant, and it looks to you all of a sudden that eating chocolate makes you smart and you win Nobel Prizes. That's not the way how it works. You can use this data to generate hypotheses. This is also perfectly good science, absolutely is. But then you need validation experiments, and in particular in healthcare, you would like to be really sure about what you're doing, because maybe the technology that you provide to someone is improving someone's health or is not improving someone's health. And before you take such decisions, you need to make sure that you really have very strong data in place. What I brought to you today is also, of course, a very good example of doing this. And it's actually just published a few weeks ago, and it's an area where patients are really sick. This is a lung cancer example. And someone said, can we improve the care in lung cancer without a big new technology, but maybe we just have an app or a survey to improve it? So how does this work? Well, the only real measure in lung cancer is, in this situation, overall survival. You really have to save lives to convince someone that you have something relevant in this area. Very high hurdle, of course. So then how it usually goes in this indication is that these patients, they can have different stages, 2 to 2A or 3B to 4. They get images done called CT. So you go to a radiologist basically and you get an image. And then based on this image, someone will know you're doing better, you're not doing better. Maybe we need to switch treatments, or maybe we need to do something else. And the question is, this is where we are, can we improve it with a new way of doing it? And somebody was very clever and said, can we improve this by asking patients how they feel? And what they came up with is a survey that's asking for 12 symptoms once a week, and the results of the survey go to the oncologist. So how does this look like? Instead of asking the patients only every 3 or 6 months to come to the radiologist, patients will be filling out the survey every week. And you can see already this gives you many more data points. And because it's a disease-specific survey, you get information that matters to this disease a lot. So what was the outcome of this? It's really exciting and certainly has received a lot of attention recently. So they found out that these patients with the survey live 7 months longer than the patients in the conventional treatment arm, which is absolutely breathtaking and something that has raised a lot of eyebrows, certainly, and a lot of people will now aspire to do something similar. Very amazing, and it did not require any new technology, really, other than the survey. If you think about how this works, probably it works in a way that it's detected earlier if patients are not proceeding well with their treatment. So treatment could be switched earlier, treatment could be escalated earlier, and this is most likely driving the better results. But overall, 19 months with this technology and 12 months with this technology is a huge improvement, of course. So the question now that people ask all across the globe is, can we repeat this and can we learn from this example? And I think of it in a way that this is about, can we improve listening to patients? And can we improve, getting good information from patients that can be considered objective and informed decision making? And I bring you one example for heart failure where this is currently being tried. So if you think of heart failure patients, and then trying to get better at listening to them, you can think of very simple questions as well. Questions like, did you need an additional pillow last night to breathe more easily? Or did you cough more than usual? Or do you cough more than usual today? Are your ankles more swollen today than yesterday? So you can ask patients these questions daily in this case, and you can combine it with a weight measurement, and people believe that also this will lead to a much better quality of heart failure care. And in the complete setting, this looks like the following. The scale is combined with a Bluetooth emitter, so this will be transmitting the weight automatically. The questions are captured with some kind of device. This can be a smartphone, can be something else. And then it goes into a healthcare data center, and people look at it basically in the end and try to figure out if this is improving. This project is still going on, and the results are pending. But I think this is the way to go, and this is a very relevant use of apps and digital technology to improve outcomes. I will keep the last pillar really short because I'm already over time. But let me say as much that shifting the business model in healthcare will be complex, and it is about looking at the big picture. The only thing that matters in the end would be the health outcomes, and the cost will be looked at very carefully to understand if this is a sustainable new technology and healthcare situation coming, or if it's not. And so to end this talk, I wanted to end on a very light note, and I wanted to show you what happens if companies don't get this right, what happens if companies don't anticipate the future and they don't use good science to develop new products. So here's a movie about that. So if you're not doing it right, obviously the technology will chase you, or competition maybe, and then there's a risk of losing, of course, and the future doesn't look so great. Hopefully that's not what happens in Italy or in other healthcare systems, of course, and I think everybody's working hard to improve this. So I wanted to thank you and look forward to also to questions in the panel discussion. Thank you.